Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
With age, we learn to accept the wrinkles, the gray hair, and the bags and sags that go with it. But for many, incontinence can be an inconvenient, embarrassing, unacceptable, and not necessarily normal part of aging. So what happens in the body that causes lack of control or leakage, and what can be done to control, cure, or conceal this problem? I'm Janet Whitmoyer, and you're watching Healthy Living for Life, a show dedicated to helping you do just that. Stay tuned. My first guest is Dr. Richard Slater, a urologist with Great Falls Clinic. Thanks, Dr. Slater, for being with us.
Thanks for having me.
Absolutely. So let's start off first by having you tell us just what urinary incontinence is.
Well, urinary incontinence is simply, losing urine, and sometimes that might be functional, meaning you can't help it. Sometimes it's because you have the urge, we can't make it to the bathroom in time, but urinary incontinence is simply the inappropriate or involuntary loss of urine from the bladder.
And how common of a problem is it?
Surprisingly, it's actually pretty common, and obviously I see a lot of it, but about 13 million people in the U.S. suffer from urinary incontinence of one form or another.
Wow, okay. So is urinary incontinence a normal part of what you'd call aging?
No, I think we oftentimes think that, our people come into the clinic thinking that urinary incontinence is the part of aging, and that's the sad part of it. But no, it can sometimes and oftentimes is a symptom of something else going on, either medical or, again, muscle atrophy and reasons why we might see urinary incontinence.
Okay. So can you tell us a little bit about what some of the risk factors might be for somebody to have urinary incontinence?
Sure. Well, obviously age is a risk factor. As you age, there are definitely changes, functional changes that happen at the bladder that can lead to incontinence. But there are other medical conditions that might be at risk factors, or lifestyle choices such as the foods you eat, or even being constipated may be a reason for having incontinence.
Okay. So I wanted to ask you a little bit of a follow-up on the foods. What type of foods would cause urinary incontinence?
Well, certainly, so foods that cause the bladder to be irritated are oftentimes the ones that are causing urge incontinence, or the loss of urine because you can't hold it. Those are spicy foods or caffeinated beverages are often the culprits there. Okay. There's a whole host of them, but those are the most common ones.
Okay. So is urinary incontinence considered a disease?
Not necessarily. It's usually a symptom of something else going on. It could be something underlying, like a urinary tract infection.
Okay.
Maybe even potentially a cancer, but again, that's pretty rare.
Okay. So are there multiple kinds of urinary incontinence?
Yes, there's a few different types of incontinence. I guess you could broadly categorize them into stress or urge incontinence is really the two major types.
Okay. Can you tell us a little bit about the difference between the two of them?
Sure. So stress incontinence is when urine leaks from the bladder, you lose urine inappropriately because you can't hold it in from coughing or sneezing, if that makes sense.
Yes, absolutely. Okay. And then, so stress incontinence, that's stress incontinence?
Stress incontinence. So urge incontinence would be the inability to make it to the restroom in time because you feel like you have to urinate, but you just can't make it there, and your bladder's squeezing in the midst of that.
Okay, all right. So can you tell us some ways that maybe people could use to manage stress incontinence?
Sure. So stress incontinence is usually managed depending on the age and depending on what the causes are, but oftentimes stress incontinence is managed with surgery. There are really no drugs available to treat stress incontinence, so really it comes down to pure stress incontinence is typically treated with surgery.
Okay. What kind of things do you do surgically to manage that type of incontinence?
Sure. In females and in some males, pure stress incontinence is typically managed with a mid-urethral sling. Okay. It's a small vaginal surgery, outpatient surgery that's used to resupport the urethra, the tube draining the bladder to help replace the anatomic attachments to help with the loss of urine. Okay. Sometimes after a prostatectomy for prostate cancer, men might have stress incontinence that's really bad, and we may actually put an artificial urinary sphincter in place, which is a larger operation, but nevertheless something that's available for stress incontinence. Okay.
So, but neither one of them are major surgeries, something that can be done fairly easily for most people?
Usually they're either outpatient or overnight, just one night overnight stays.
Awesome. And so, in addition to stress incontinence, we did talk about the urgency. Can you tell us a little bit more about what urgent urgency incontinence entails?
So urgent incontinence, as we talked about, can be caused typically from having an overactive bladder from obviously, or things that cause the bladder to be irritated like foods or even some medications. Overactive bladder is mostly managed with behavioral therapies.
Okay.
That'd be the first thing, is kind of correcting those things that are causing it, or maybe underlying culprits, such as the foods or constipation. But if that doesn't work, there are medications available to help manage people with overactive bladders. And those medications fall into a few different categories. There's a number of medications on the market. Most of them are, they're anticholinergics, and there's one that works a little bit different. But those medications help slow down the bladder so you can hold urine longer.
Okay. And is there a way to treat an overactive bladder other than, like you said, medications? Or
well, behaviorally is obviously the first and foremost. I mean, adding medications is never something we try to do. So behaviorally, trying to increase the amount of time you might be able to hold urine between voids might be one way to slowly increase that time frame. Again, removing the offending agents are most common, the reasons or the best ways to treat urgent incontinence.
Okay.
And if you fail medications, there might be some small outpatient procedures that might be done to help with that, such as Botox to help relax the bladder. Or neuromodulation, which can, the bladder runs off of the pelvic nervous system, and so we've discovered that if you modulate these nerves, you can actually increase the bladder's capacity.
That's really interesting. So Botox, I just wanted to follow up on that. Is it an injection that you get for Botox?
Yeah, it's cystoscopic, so it's a procedure where you go into the bladder and you submucosally underneath the inside layer of the bladder, you inject small aliquots of a Botox that helps paralyze the nerves of the bladder to help increase the capacity of that bladder.
In about the last minute that we have, could you tell us, Dr. Slater, what you would like people to know about incontinence and how they can improve their lifestyle or live with incontinence so that it really they can actually deal with it a little bit better and not have to worry about being able to live a normal life?
Sure, that's a good question. So I think that the first thing I'd like everyone to know is that urinary incontinence is something that you don't have to just accept because you're aging, or accept because you had babies and you're wearing 7 pads a day, and you're wetting your pants all the time. So I think the first part is just the recognition that it's abnormal and that it needs to be brought to your attention. Obviously, you see your primary care physician or see a urologist to discuss further. But I think that it's something that you should recognize it's a symptom of something underlying, and we should look into it and potentially be able to offer therapy to help manage that.
Okay, awesome. Well, thank you so much for the great information. This has been very helpful.
You're very welcome.
Next up, learn about another type of incontinence. We'll be back right after the break.